Hello, I'm Dr. Christopher Rapuano, Chief of the Cornea Service at Wills Eye Hospital. Today, herpes zoster or shingles is back in the medical news. Shingles or herpes zoster is an extremely important condition for patients of all ages and certainly for us in ophthalmology. Shingles will affect about 1/3 of patients before they die, and about 15 to 20% of shingles cases will occur around the eye. When shingles happens on the skin outside of the eye, it can be a devastating condition with short-term but also long-term pain. However, when it happens in and around the eye, it can cause severe short-term eye and vision problems, but also significant long-term eye and vision problems, potentially with significant decreased vision. We've been proponents of a shingles vaccine for many years. The vaccine that's available now is made by Merck, and it's rather effective. However, it does have some limitations. It's about 70% effective in patients in their 50s, but it goes down to about 64% effective in patients in their 60s and down to 38% effectiveness in patients 70 and above. And this is rather important because the incidence of shingles, the chance that someone will get shingles, increases with age. And the overall effectiveness is about 51%. Having said that, we still recommend it for patients 50 and above, and if you haven't had it in your 60s or 70s, absolutely it is time to get it. The news, however, is that in the New England Journal of Medicine, just this past week, results of a new experimental vaccine were published. This vaccine is made by GlaxoSmithKline, and it was tested in 18 countries with about 15,000 patients who are ages 50 and above. This involved 2 shots, 2 months apart, and patients were followed, at least so far, and what was published, followed for a minimum of 2.5 years, with a mean of about 3.5-year follow-up, with a plan to go out to 5 years. Interestingly, this vaccine was 97% effective. And even more interestingly, it was effective equally in all age groups. So patients in their 50s, 60s, 70s all had approximately 96-90% effectiveness. This was compared with placebo, and you were 30 times more likely to get shingles if you were in the placebo group than if you were in this new vaccine treatment group. So it will take a little while, several years I imagine, before this vaccine can go through the FDA process and get FDA approved and also get recommended by the CDC. However, we are extremely excited about the possibility of a new vaccine that's even more effective than the current one. We still recommend the current vaccine for all patients over 50, so don't delay for a new vaccine, or don't wait for a new vaccine to come out, but when a new vaccine comes out, if it's more effective, we'd certainly jump on that one. I'm Christopher Rapuano, Chief of the Cornea Service at Wills Eye Hospital. Thank you very much.